This episode touches on topics that may be sensitive for some listeners. Welcome to Mom in Mind, a podcast about maternal mental health discussing conception, pregnancy, birth, and postpartum. Real stories from moms and family members who have made it from struggling to wellness, and interviews with experts and advocates who work for moms and families to get the help they need. This podcast is meant to offer information and awareness and is not a replacement for treatment by a professional or professional training. Welcome back to Mom in Mind. I'm your host, Dr. Kat. On this episode, I'm honored to talk with Raul Martinez. We'll be talking about how postpartum mood changes impacted his wife, himself, and their family. We'll be talking about the loss of his wife, Kelly, to complications from postpartum depression, which led to her suicide when their daughter was just 3 months old. Some of the things we discussed today may be difficult to hear. We're discussing this, though, because we need to. We, the collective, we have to be aware and proactive and informed. We have to be helping moms and families so that suicide can be prevented. Sadly, postpartum depression is the number one complication of childbirth, and suicide in the postpartum period is the second leading cause of death for women. This is a really big deal, and why we're talking about this today. Raul has become an advocate for improvements in perinatal depression awareness, prevention, and treatment. Raul has been featured in documentaries about postpartum depression and has spoken before the California legislature, at medical training seminars, and to numerous community groups in an attempt to raise awareness and to effect change on behalf of women, children, and families. Thank you so much for being with us, Raul. I'm so happy to talk with you today.
Oh, great. Thank you for having me on.
Yeah, I know that you've been doing a lot of work and a lot of advocacy work. So I'd like to kind of orient folks who are listening to what happened for you and what happened for Kelly and her story, and then we'll go from there.
Okay, sounds good.
Yeah, so if you can, just kind of share your story and about your late wife, Kelly.
Okay. Well, Kelly and I got married in 2006, and, we decided we wanted to start a family. And so, after a couple of attempts, we finally were blessed with our child, our Melina, and she was born in November of 2009. And we were very happy. And Kelly was one of these people that really liked to prepare and to get all her ducks in a row and wanted to do everything possible to give our child the best start in the world. So, we went to all the classes, the prenatal classes. She went to all her prenatal appointments, prenatal vitamins, maintaining a healthy weight, exercising, and so getting the baby's room ready, interviewing and selecting pediatricians. Mm-hmm. And, so we were really trying to put ourselves and our child in the best position to succeed moving forward, especially as first-time parents. It's a daunting task thinking of trying to raise a child. And so everything started fine until, we had the birthing plan and all of that, but then we did have an unplanned C-section. Mm-hmm. And from there, we were in the hospital, and hospitals aren't the most conducive to rest.
Right.
And so we were in there for probably about a week, while Kelly was recovering from the C-section. And obviously having a newborn just in and of itself is difficult to sleep.
Yeah.
And unfortunately, Kelly was not a good sleeper. Mm. That was one of her risk factors, is she was not a good sleeper. So she would try to rest and sleep when Melina was asleep, but she had a hard time shutting off her brain. She was anxious about everything that didn't go the right way, during the birth. And unfortunately, that continued on. Mm. Is that once we got home, she also was unable to sleep and rest while Melina was taking naps and whatever. And, I think it was the accumulation of the sleep deprivation over several months that by mid-December, something was clearly wrong, and she knew it. And so she was, but because of the holidays, it was difficult for us to get in to have her see anybody. Uh-huh. And it wasn't until early January we were able to have her go in, and it was her choice. She wanted to see a psychiatrist to get evaluated, see if she could get on some kind of medication. And she did finally get a hold of a psychiatrist, and not the one she wanted, because there was a big backlog to get into this particular one that focused really on women and new mothers.
Oh.
So there was a big backlog. She couldn't get in to see that one. So we started seeing another one. And, unfortunately with some psychiatric medications, it's hard to find the right combination of them and the right dosage. And not only that, you can't just start at the therapeutic level. You have to kind of like work your way up.
Right.
And it might take a couple of weeks before you get to a therapeutic dosage. And so during the meantime, all her symptoms were starting to get worse and worse and worse. And she started having thoughts of, suicidal ideation, thoughts of, she would walk into a room, she would tell me, and any room she'd walk into, the first thought would be, what is in here that I can use to take my own life?
And she was telling you about that?
Yeah, she did. And that was really scary to hear. But I was glad that she was being honest with us, with me and with her mother. And, she shared these feelings with the doctor. And finally, the medication started kicking in and taking the edge off of some of those feelings, But unfortunately for her, she was one of these people that any medication she took, it would increase the side effects for her. She experienced the worst of all the side effects from all the different drugs. And it didn't matter whether it was a psychiatric medication or whether it was, Tylenol or anything in between. If there was a side effect, she was going to get it. She was going to feel it. So unfortunately, she did not do well on the medications. And I'm not exactly sure. And unfortunately, I'll never know the truth. But on February 8th, 2010, she did take her own life at her mother's house while she was down there for the weekend, trying to just relax, get some rest, rejuvenate, and recover. And she had some bad experiences with one of the psychiatric medications. They tried to switch her to another one, and it just didn't work. And I told you there was those feelings of anxiety.
Yeah.
And I think it just kept building and building and building. And that combined with the sleep deprivation, combined with her sensitivity to the side effects of the drugs, I think, the different physicians I've spoken to that are experts in the field of emergency medicine and, psychiatric care, they all believe that she suffered a psychotic break and, caused her to take her life. And so I've spoken to the California State Legislature a number of times. I've spoken to women's groups. I've been in a couple of different documentaries. And really, I think for me, when I try to share our story, is I try to encourage people to, as physicians, people that come in contact with the mother while she's pregnant, and then also for that first year afterwards, just to really realize how important it is to assess those risk factors. And, even if someone's not on the riskier side, that doesn't mean they don't have any risk factors or that they can't be mitigated.
Right.
And so that's what I try to really advocate for, is to have regular assessments during the prenatal period, during the postpartum period, and to remove stigma, raise knowledge, raise awareness for both the physicians, but also for the patients to know that it's okay to speak up. And I've heard of cases as well where in certain ethnic or cultural or religious backgrounds, it's more frowned upon to have some kind of psychiatric problems. And by educating not only the woman and her partner and their family, if something does come up later on down the road, then I think it's easier to broach that subject and say, hey, I'm not feeling okay.
Right.
I think something's wrong and I need help. Because if the doctor or the nurse or the midwife or whoever, 6 months earlier said, oh, these are your risk factors and this is a real thing, I think it kind of legitimizes that for the family and makes it easier to talk about that if historically their culture or, like I said, religion or, whatever has frowned upon that. So that's kind of my message, is to raise awareness and, just reduce stigma.
Yeah. And you have been doing so much work to get the word out there. And I so appreciate what you're doing. And I know all of the families who come in contact with you also do. And in part of kind of raising awareness, each person's story and path is different. But for Kelly, looking back on it and knowing what you know now, what are some of the signs or things that were tip-offs that would have been Now, you mentioned some of her risk factors, but things that you know now about how she was doing that would have tipped you guys off to get help sooner.
Yeah, I don't know if there are any actual signs because she was pretty honest with herself and with us.
Oh, that's great.
Yeah, it was great. It's just for her, I think prevention would have been the best treatment.
Yeah.
And so, because where we were being treated, they did not regularly screen at that time for risk factors.
Mm-hmm.
Now they do. As a matter of course, they now, in their practice, screen all of their pregnant mothers once a trimester. So 3 times before the baby is born, they're screened, and then they're screened immediately thereafter, and I think at certain intervals after the baby is born.
Mm-hmm.
And so Kelly was extremely high risk, I think mainly because she had a family history of mental illness, and because she herself had experienced 1 or 2 bouts of clinical depression that needed to be treated with medication. And then you combine that with the fact that she was not a good sleeper and was prone to anxiety.
Yeah.
All of those really, I think if she would have been screened earlier, I think for her, it would have been really helpful to have cognitive behavioral therapy to teach her like positive, healthy, natural ways to have almost, if you will, a mental pathway back to like a peaceful mindset.
Yeah.
And I've been told that cognitive behavioral therapy is much better and more effective when you can train yourself and work with a therapist that knows how to do that before you're in crisis. Once you're in crisis, you can't learn that technique. It has to be something. So for her, I think it would have been preventative because really for us, I think the signals were just the sleep deprivation and just to see it. She just, was wearing down and mentally breaking down. And, so I guess that would be, to answer your question, those would be the signs in our case that someone could have seen is just she was so tired and so exhausted and, her mind just wasn't working the way it usually would. And, and I think it's to be expected for all new mothers is, to have a period of sleeplessness and, exhaustion. So, or, the baby blues. But I think once it goes beyond a week or 2, and if it continues on and there's no improvement, I think that would probably be a good starting point to say, hey, maybe we need some professional help, some intervention to get us back on track.
Right. And you listed quite a few things too, that people can be on the lookout for. If folks who are listening, if you already know that you have a history in your family of depression or anxiety or other mental changes, or if you yourself have had one, those are things to really keep an eye on during this massive transition from, pregnancy and postpartum, where things are just out of whack for a little while.
Right.
Because of the nature of, being pregnant and then having a newborn and what you described, that difficulty with sleep. Yeah, all moms struggle with sleep, but as you mentioned, some have more sensitivity to sleep or lack of sleep than others. And certainly, maybe you said that Kelly already had a history of difficulty with sleep sometimes.
Yes, definitely.
Yeah, those are really, really good things for the folks who are listening. And there are quite a few therapists also who listen, and providers and family members. These are things that we all kind of deserve to know about in order to protect ourselves and our situation and our families, so that these kinds of things are not unexpected. The transition and difficulty of pregnancy and postpartum, we can prepare.
Exactly. And, to follow up with that, people ask me my opinion on a lot of different things. In particular, they ask me about, co-sleeping, and they ask me about, 24/7 on-demand breastfeeding. And, I don't think there's a cookie cutter answer that's correct for everyone.
Yeah.
I think we're all different in every aspect of our life. And especially when it comes to bringing a new little one into the family, it changes the dynamics and the relationships and, just the flow, the natural flow of timing and scheduling of just all activities for everyone. And so I guess I'm not a big proponent of any one hard and fast rule, but I guess what I would say is that you can take these risk factors if you get assessed and say, okay, sit down and say, what's best for the family? Because if you do everything just based on what's best for the child, it ignores the mother.
Right.
or maybe the father, or maybe the siblings.
Mm-hmm.
And then it's detrimental to other members of the family. And
Right.
particularly if the mother is not being well taken care of, that will indirectly negatively influence the newborn.
Right.
So the mom needs to be taken care of just as much as a child. And I think people lose sight of that when they try and focus all on just what's best for the child,
Right.
because then the mom is getting neglected. And I kind of liken it to when you get on a plane, right?
Mm-hmm.
And they say in the event of a loss of cabin pressure, put on your own mask first
Sure.
before you help your child.
Mm-hmm.
And the reason is because if the adult isn't there to help the child with the mask, then, that's
Both
a
of them.
problem. Exactly. So for us, for instance, we tried to do the 24/7 on-demand breastfeeding and the co-sleeping, but because of Kelly's highly sensitive nature towards her sleeping, I think for us that was a bad choice.
Right.
Now, for some mothers who have no problem going back to sleep,
Mm-hmm.
after they're woken up, either by a child that's crying at night or, after doing a midnight feeding, then, fantastic. If it works for them, then I think that's great. But if
Right.
it doesn't, I think people need to be flexible enough that they can, I guess, marshal their resources in the manner that best suits the entire family,
Right.
not just the child or just the mother, because it could go the opposite direction of being too extreme towards just taking care of the mother and,
Right.
not doing what the baby needs. So it's a fluid and dynamic situation. And, I think people should take all the different factors into account.
Right. For the dads who are listening or the partners who are listening, like, what are the kinds of things that you might have needed support with, or what are the pieces of advice that you can give to partners who are listening?
I guess for partners, I would just say try to be flexible. And, it is a fluid situation. Just realize that the new mom and the new baby are just getting used to their new roles. And you're getting used to your new role as well. And, what might have worked a week ago might not work next week or a month in the future. So try to be flexible. And, so the partners, like I said, just like with the new mom and the new baby, they also need to be taken care of too.
Yeah.
They can't run themselves ragged to the point where they're no longer helpful to the new mom or to the new child.
Mm-hmm.
So it's kind of something that, they need to take care of themselves, but stay mentally and emotionally flexible. And, don't be afraid if they see something with their partner, maybe in advance, if they know that it's the new mom, if they've gone through this risk assessment and they know what the risk factors are, be open to, I guess, to doing things maybe a little differently than you had planned to help mitigate those risk factors. But at the same time, maybe have an open and honest, like frank discussion before the baby arrives and say, hey, if I see something going on with you, how would you like me to bring that up to you? Because sometimes new moms can be sensitive, right?
Sure.
And so if you have that discussion in advance, maybe there can be some key words and, phrases that let them know I'm not coming from a place of judgment. I'm concerned, or I've noticed this, or I'm just checking in with you. And so maybe when the new mom hears those little phrases or key words, they know their partner is only trying to express help and love and support. But hey, I see that, like sleeplessness was one of your risk factors, or depression, and you seem to be, not sure, but it seems like this might be something that is becoming a problem, or, that we're struggling with. Is that how you're feeling too? And if so, do we need to seek professional help? Do we need to maybe have a family member come and stay with us for a week or two and help out a little bit more? So I think if they have that kind of strategy in place, I think it makes it easier later on and make the new mom not feel like maybe attacked or judged or anything. So
that's the beautiful perspective and really great advice. And that's really coming from a place of, I love that preparation and just kind of taking care of the whole family by planning ahead a little bit and really having a discussion that things are going to be different, and how can we communicate through that? That's perfect. I love that. And it sounds like, having the information on hand for you and for most partners would be really helpful beforehand.
Yes, definitely. And, me personally, I had never met or known anyone that had admitted to me that they had a mental health issue. So for me, it was completely foreign. And I was trying to be supportive and understanding, and, I just wanted her to get better. And so,
Yeah.
for me, I got to the point where, I had our daughter on the couch with me at night sleeping so that, my wife could sleep in the bed by herself undisturbed. So we would have, breast milk that she had pumped. And so, if our daughter got hungry in the middle of the night, I could feed her. And I was trying to do as much as possible to be supportive. But again, I think in our scenario, I think Kelly's best defense against all of this would have been prevention. There's different treatments that work for different people. She actually wanted ECT, which is electroconvulsive therapy, but, a little more difficult to get that in some states than others. And in California in particular, it is a little more difficult to get. If, like you asked before, would I've done certain things differently? And the answer is definitely for this one is that if I would have known back then how severe it was and really understood, I definitely would have just put her in the car immediately without even packing a bag or anything and driven to, at that time, probably Arizona or Oregon, which are the two closest states that it's fairly easy at that time to get the ECT treatment. And I think it's not a treatment in the sense of it's going to cure you, but it will kind of like reset your brain chemistry to the point where it allows other therapies to work, like maybe, the cognitive behavioral therapy, because then you're no longer in crisis at that moment.
Right.
Or maybe some of the psychiatric medication that she was taking, maybe to help through that period where she's transitioning from just starting to take the medication to the point where it actually becomes therapeutic and effective. Because waiting a couple weeks for a certain medication to become effective, when you're having a hard time going 5 minutes without thinking of killing yourself, 2 weeks is an eternity. So, for us, and, I'm sorry, I'm focusing a lot on the postpartum psychosis aspect. That just happens to be my experience with this. But I know for other women and families that don't get to the level of psychosis, I just say that, try and be open to all your options and the treatments. And, and if you have to go, if you can't find, if your local providers cannot give you the level of support you need, I would highly recommend that you beg, borrow, steal, do whatever it takes to help your partner, because in the long run, it'll be worth it for them, for you, and also for your child.
Absolutely. Absolutely. And I think you brought up something, or anyways, I heard something that even though she was speaking to you and telling you how bad it was, that unless it's hard to know really what that's like, because a lot of her experience is happening kind of in her mind, in her head, I should say. And even though she was being honest with you, which is awesome, it's still hard to understand the intensity of it from the outside.
Oh, of course. Of course. It was very difficult to understand. And like I said, I hadn't had any previous experience with mental health issues. So for me, it was completely foreign. And I know for a lot of partners out there, they're probably in the same boat. And so that's what I'm saying. For them to understand the level of risk associated with their particular, the mother of their child, of their newborn, to understand how many risk factors do they have and what are the issues, and and how to best deal with those. If you can prepare in advance mentally that these things might come up, but then they might not. There's no guarantee. But I think that is helpful to just be aware that it might be an issue and it might not. So
So in the work that you've been doing for this amount of time now, several years, advocating and bringing the awareness out, have you seen change happen? Have you seen people become more aware? Have you seen fathers or partners taking more of an interest or understanding of what's going on?
Well, I think the answer is yes, but it's slow because, the people that I speak to a lot of times, or I might speak in front at a conference for health providers. So I don't really get any feedback from them so much as far as, my patient population has started to show more, an uptick in awareness and reducing stigma and reporting these kinds of issues. I don't get that kind of feedback. And then obviously people don't come to me. I do have friends and family members and, extended people in my network of contacts that will come to me and say, hey, my coworker's sister-in-law is starting to feel some of these things. Who should she talk to? And so I'll give them contact information, referral information for support groups and warm lines that they can call. But see, I never get any feedback, so I don't hear back if that was like a positive thing that actually helped them. So, but I have to believe it is helping because I've seen, different documentaries, different people being interviewed on TV and different shows that describe what they went through and how they got help. And so when I see that, and I know that message is being broadcast more and more, and as I mentioned earlier, the practice where Kelly was treated, it was a midwife practice during her prenatal stages. I now know that they screen, well, not screen, but they assess for risk factors every trimester now for all their patients.
Great.
So I have to believe that those kinds of things are now helping, and I see more and more resources popping up, maybe in the form of, inpatient, outpatient type centers where if a woman is feeling some of these things, whether it's depression or anxiety or any of the other mood disorders that come along with this, or even psychosis, that these centers now allow women, new moms to bring in their babies with them.
Yeah.
And I think that's key, is that instead of treating the mom like there's something wrong with you, it's like, why don't you come down, bring your baby, on Tuesday at 3:00, and there's some other new moms that are also having some feelings, and you guys can sit and talk and share and bond. And, there might be, you can have your babies with you, or there might be a little nursery off to the side where there's, caregivers that can, watch your baby while you're in there talking. And some of those scenarios, the women can stay there for a day or two if they need to, and their baby's there with them, and they get to see the baby. Whereas, in the past, I think since they treated the mom and the child as different entities, and where the mom would have to go to these appointments by herself, or if she needed more intensive care therapy, she'd have to be separated from her child. I think she'd be less likely to participate in that for a number of different reasons. And so it makes me happy that a lot of these resources are now available to these families currently. And I wish that they were available at the time, but, when you know better, you do better. And so I'm happy with the direction everything's going.
You've done so much great work in the field from what I've seen, and from the outside, kind of looking into the work that you've done. I've seen you advocating and being a part of these documentaries of really getting the word out there. So I know that it has to be helping because the message is getting out. And even for those moms or partners or family members who are, sitting and kind of getting this information through a documentary or even through the podcast, or just kind of seeing a celebrity come and talk about it, the awareness is part of what helps us to get the message out there that moms and family members can be helped through this. So what kind of support have you found? What kind of messages of hope and healing do you have for families who may be struggling?
I guess, as I was mentioning before, the current state, the new standard of care, I guess I would call it, is much higher than it was, even just 7 years ago when Kelly died. It seems like a lot more practices are aware that they screen more or, assess the risks. It seems like there's a better networks for referrals, that if a risk factor is found or identified, that it's easier for different medical practitioners to refer the mother. There's different facilities, as I mentioned earlier, that seem to have a more almost, I guess, for lack of a better term, a more holistic approach where the mom and the child can go together and stay as long as they need to be treated. I think in those scenarios, it's easier for a mom to feel like, okay, I'm not abandoning my child to go get treatment for me. As we're going together to treat us. And I think that it's easier for the mom to say, yes, I'm willing to do this. Or for, say if it's a family where it's just the parents and the new child, and maybe the grandparents or relatives, extended family live far away, so they don't have an extended network of people to help them. It would be difficult in that scenario for the mom to just say, well, I'm leaving for 2 days to get treated, and now the partner has to take time off of work, for 2 days. Sometimes that's not possible. So it's nice that a lot more treatment options are available, and there's movement growing as far as all aspects, from the legislative side of things, from the medical practice, from the societal reduction of stigma. So I'm very optimistic for the direction things are going. And I would say the help is out there. And just, in some of the campaigns I've been involved with, to speak up when you're down, is that I think that's the most important thing, is that, people can't help you if we keep it inside. you need to speak up, whether it's to your parents, your siblings, your partner, a friend, a coworker, a church member, your physician. You have to say that you need help. If you don't let people know, then they can't help you. So, and they're just going to assume everything is fine. So,
unfortunately, they do. Yeah.
Yeah. So, and that goes also for the partners out there. If the partner is dealing with something, they need to speak up too. And it doesn't mean you're weak. It doesn't mean there's a problem. It means you're being honest. And with anything, whether it's a problem in your emotional well-being, your financial, your career, in any aspect of life, if you don't identify the problem and then communicate it to the outside world, it cannot be resolved.
Yeah.
And so I'd say that's the first step, is just be honest with yourself, be honest with those that are close around you, that you trust and, that support you. And if you knock on one door and it's not open to you, don't stop knocking until someone answers the door, because, it could be possible that a new mom, tells her partner, and maybe for religious or cultural or whatever reasons, he might not believe her or might say, oh, it's all just in your head. Okay, well, don't stop. Go to the next person. If you have a sister or a friend or a neighbor or a parent, or, no matter how many times people say, no, it's just in your head, you can get over it. Ignore those people and go to the next.
Yes.
And just keep going until you find someone who believes you and wants to help you and support you, and don't stop till you get the help you need.
Man, Raul, that is gold. That advice is gold. It's so true. Just because somebody denies how you're feeling or doesn't understand it doesn't mean it's not true. And it happens so often that once we feel shut down or misunderstood, that we, sit back and stop kind of questioning and fighting and getting the help. I really appreciate your perspective and that advice. It's so good.
Yeah, of course.
Yeah. So I thank you so much for being on with us and for sharing Kelly's story and all of the work that you're doing now and continue to do. It really is amazing how this pain for you has turned into this beautiful work that helps so many people.
You're welcome. And thank you for having me on. And thank you for your work on this podcast and all the other work you do to help people out. It's beautiful. And I'm inspired by you and your actions. So thank you for your work.
Oh, man. Thanks. I'm almost tearing up. Thank you so much.
Yeah, you're welcome.
Hearing Raul and Kelly's story is a powerful and difficult reminder of what can happen when mothers, families, and providers are not informed or aware of how to prepare and care for themselves and mothers and families. And we have so much work to do. And Raul is so right when he says that we need to keep knocking on doors until we find someone who listens and knows what to do. If you or someone you know may be struggling, please reach out. You can look at www.postpartum.net, which is Postpartum Support International, for resources for help in your area, as well as information about symptoms and risk factors. You are definitely not alone, and you can feel better. Thank you for joining us today. If you or someone you know is having a hard time, help is available. Please look for resources for help at momandmind.com. Also, please subscribe and share this podcast. Together, we can support moms and families so that no one has to deal with this alone. Thank you for being a part of the Mom and Mind community.